guys, Carmen here. I get a lot of emails from people who are searching for a provider, and they ask me a very common question most of the time. How do I know I'm getting a good provider? How do I know what they're doing? So I just want to kind of touch on a few things. The first thing that's important to remember is dentists who do frenectomies, everybody's taught to do this in dental school. Some of them may not have done it in a long, long time. So while yes, technically, they do know how to do the procedure, it might not be their forte. So I always encourage directly asking the doctor, is this something that you're comfortable doing? Do you do a lot of these? Do you do them for children? Do you do them for babies? Do you do them for adults? There definitely is a difference there. So one of the most important questions, of course, that I want to know as a myofunctional therapist is, does this doctor require or encourage myofunctional therapy? Now, it's important to do myofunctional therapy before and after the procedure. So the procedure is just, something that happens in the middle of it. Just because you have a frenectomy done doesn't mean that that corrects the impairment that you have. So if you're asking a doctor how many procedures they do, you can ask about their method, although the method is not as important as the expertise of the provider. But ask them about their understanding of myofunctional therapy, if they encourage it. If you meet somebody who doesn't even know what you're talking about, then I say run away from the building like it's on fire, because you do not want this person to be doing your procedure. Another thing that I kind of frown upon is lately I have had a lot of providers who don't want to share their information. And I think that's really weird, because the specialists that I work with, they want other people to know how good they are. So when I have somebody contact me and I say, okay, so who's the doctor that you're thinking about using? And they tell me, well, that doctor would rather me not give out his name. Again, huge red flag, and I think you should run the other way. So I hope that helps you guys. Make sure that you're comfortable. Follow your gut instinct. If you don't feel like this provider knows what they're doing, if they haven't done a frenectomy in years, if they don't do a lot of them every month, then you probably want to find somebody else who might serve your needs better. So I hope that helps, and I will see you in the next Myo Minute.